The most recent CDC influenza surveillance report reveals that 44 jurisdictions had influenza activity of high or very high, yet vaccination activity remains low across the country.
Joining us today are doctors Darlene Lawrence and Kelly Good to share some information about flu vaccine safety and guidance about who is at greatest risk. Welcome. Thanks for joining us, doctors.
Thank you.
Good morning. Thank you.
Yes.
Thank you.
Dr. Lawrence, starting with you, why is flu season so severe?
So flu season this year is so severe because we have 33 million illnesses that have been reported, 430,000 hospitalizations, and over 19,000 deaths. That's pretty serious. It has been more than the past because, like you said, people are sort of hesitant and they're not going to get that flu shot. And so it's been spreading more than it has in the past years.
Okay, good tip. Yeah. Good
Now,
info.
Dr. Good, is it too late to vaccinate? And how can people actually be sure that vaccinations are safe? That's a real hot topic right now.
And no, it's absolutely not too late to get vaccinated. You know, we usually think about flu shots as sort of a fall activity, but as we've mentioned, it's active in most communities now. And the flu vaccine is not only a safe and effective way to guard against flu, but it also really plays a crucial role in reducing potential for other serious complications. And so if you haven't gotten your flu shot, you should really make plans to visit your doctor or pharmacist and get it as soon as possible. It really helps to build that sort of community of immunity.
Okay, yeah.
Community of immunity.
Yeah.
I like it.
That's what I can remember.
Yeah.
Who do you find is at most risk when it comes to the flu?
Yeah, the flu is highly contagious, as we've talked about, but it can be particularly dangerous in the elderly, individuals with underlying chronic conditions, and children. However, that community of immunity, the more people who get vaccinated, the better protection there will be for these vulnerable groups. So if you're over 50 and you have any chronic conditions like obesity, heart disease, or diabetes, it's really important for you to get your flu vaccine. And if you talk with your doctor or pharmacist, they can help you decide which flu vaccine might be best for you.
Well, that's good to know.
Yeah.
You can talk with the people about the different one to get.
Yeah, and so in that same breath, how can folks, Dr. Lawrence, find out about preventing serious flu complications and getting the right flu vaccine for their age? I didn't even really know that there was a right or wrong one, so I'm probably very ignorant.
You are very smart because you're asking the right questions. There is a lot of misinformation out there and just a lot of information, and it can be tough to navigate that information. So you can talk to your doctor. They have that information. You can talk to your pharmacist right at the store, and those are two very trusted sources.
Yeah.
What's even nicer is right from your home, you can go to familydoctor.org where they have an actual click on flu season and flu vaccine where you can get a lot of information that has been vetted and it's ready for you so that you can see what questions you want to ask after.
That's great.
Oh,
Give us
that's
that
helpful.
website one more time. What was it?
familydoctor.org.
familydoctor.org. Great.
Yes.
Great place to get answers to all of our questions out there.
Absolutely.
Thank you both
Thank
for
you, ladies.
joining us, raising awareness about flu vaccinations during this very important season. We appreciate
Yes,
you and your
thank
time.
you.
Thank you
Thank
so
you
much.
so much.
Absolutely.
Yes.
Thanks.
Oh, man, I think I need to get a flu shot.
gotta get your flu
I
shot.
know. I have been
And
putting
then
it
tell
off
me-
and putting it off, and they're nodding their heads. I can see them right there like, you need to go do
And
it.
then you need to tell me which arm it's in so I can give it a little
Oh, yeah,
pat.
give it a
Make
smack.
sure it's
Great.
in there real
Yeah,
good.
thank you.